So you got your MRI report back, and on your MRI report, it says disc bulge, disc herniation. Or maybe your doctor called you. Maybe somebody told you this. Maybe you read this somewhere, and you're wondering if you have this. So it's 11 o'clock at night, you're Googling, you're trying to find out more information about what a disc bulge is, what a disc herniation is. You're getting all this different types of information. You're getting confused. You're not too sure. You need a clearer understanding. Today, I'm going to explain that to you. Watch this video. I'm going to explain to you what a disc bulge is. I'm going to explain to you what a disc herniation is. I'm going to explain to you if you have it, if you have both, if you have one or the other. I'm going to go over the anatomy. I'm going to go over the symptomatology. I'm going to go over the problems, and I'm going to go over the solutions on what can be done and how you can address this. My name is Dr. Shariff. I'm a local chiropractor in Oshawa, Ontario. I've been serving patients in the Oshawa region, the Durham region, the Bowmanville region, the Clarington region, the Curtis, as well as the Whitby region. And our clinic name is Infinite Healing Chiropractic Wellness Center, and our mission is to help optimize your health. And so we have patients come in all the time that talk about their discs, that have MRI reports, that talk about disc issues and stuff, yet are confused and have no idea what they're dealing with or haven't been properly explained things by their doctor, and they need clarity. And so the one thing I hear about is a slip disc, and I hear that term a lot. And guess what? Discs don't slip. And I've done a video on this. So I encourage you to watch this video on why discs cannot slip. It's going to be in the link in my description for this video. So go ahead and look at it and go ahead and watch this. And if you're new to this channel, I'm going to ask you to like and subscribe to this channel, because I'm going to keep on posting more content with regards to disc, with regards to your body, with regards to your spinal health, on how you can optimize that. And as I post more content out there, you'll be alerted as it comes on if you liked and subscribed to this channel. So let's understand what's actually going on, but let's first understand the anatomy, and that's an important thing to understand. And so there is, in your spine, there's vertebrae, and then there's discs. Now, the vertebrae, there's 33 vertebrae in your spine, and in the center of the vertebrae is the spinal cord that's going through. Coming out within each area between the vertebrae are spinal nerves that are coming out. Now, I'm using this spine here because I've been able to take it apart so I can show it a little better visually. So you'll see between each vertebrae, there's a disc, okay? And these discs exist, okay? And they're like shock absorbers. So it's an analogy a lot of people use, and it's got some purpose to it and stuff, because they are a shock absorber, because your discs handle a compressive load every day, whether it be sitting, whether it be standing, whether it be driving, commuting and stuff. Your discs will handle a load. And you think about it, the commuters that are in their car for like an hour a day going back and forth, that's a compressive load they're stressing and they're facing. But it's also the person who's got a desk job. Well, the person who's got a desk job is sitting for a long period of time. And especially if they're not taking proper breaks, that's a load on their disc. And even the person who's working and stuff on their feet, that is a load on their disc. So when you're seeing these loads on the disc has to be able to absorb it. And that's the important thing, is that can it absorb it without impacting anything around it, the structures around it. So how does it absorb that stress? And it has to release that stress too that comes on it. Well, the disc, if you break it apart and stuff, you'll see that the disc is circular, okay? It's got these circular rings on the outside. And these, what it's called is that's called the annulus fibrosus. And this is the outer part of the disc. And these are very, very tough rings, extremely tough. And so if I was to, and in the middle part, it's actually what's called the nucleus pulposus. The nucleus pulposus is the middle part of that disc, and it's like a jelly-like substance. It's got water in it, it's got proteoglycans in it, it's got type 2 collagen in it, but it's got a lot of water, about 70 to 80% water, so it's fluid-filled. Now, let's think about this. Let's use the hamburger analogy. So remember this, the hamburger analogy. So you think about a hamburger, and you've got a burger, okay? So you've got two buns, and then you've got the patty in there. Now, if you took that, what you're saying is the buns are the vertebrae, okay, and the patty is the disc. Now, if you were to squeeze down on it, just like a compressive load coming down, you'll see that the buns are going to start to flatten, okay, and the annulus fibrosus, the disc, the patty is going to stay the same, but if you squeeze, it's going to start to bulge out a little bit on either end, okay? And that undue pressure is going to create that bulge that's happening. That's your disc bulge. Now, here's the thing. a lot of us have disc bulges. It's a natural phenomenon. So it's not like a disc bulge could be a problem. It may not be a problem. You may have a disc bulge and be told completely fine. It is when that disc bulge gets so big that it starts to impact on the structures around it. So when we talk about the structures around it, well, think about that. Behind that disc is the spinal cord, okay? There are nerves that are coming out from either end of that spinal cord. And so when you think about that, you have the spine right behind it. You have these nerves that are coming out here. So that bulge starts to happen. It could hit that nerve. It could hit that spinal cord, and it could start to impact those areas. There's also ligaments there. There's other structures around this area to help keep that disc in place, but they all could be impacted. And that's where you could start getting your discomfort and your pain. So really the question isn't if I have a disc bulge, it's that how bad is my disc bulge and is it impacting structures around it? So when you're looking at a report, you want to see, is that disc bulge touching that nerve? Is that disc bulge touching that spinal cord? And then understand what symptoms could be occurring because of that. Now that's the disc bulge. Now we get into what is a disc herniation. And I'm going to switch to another analogy, and that's the jelly donut analogy. So think of a jelly donut with the filling in the middle. That's your nucleus pulposus, okay? And your disc is the donut itself. Now, when that donut gets squished, that jelly in there is going to move. Now, here's the different types of herniations, because there's 3 different types. One is called a protrusion. A protrusion means that the annulus fibrosus, those rings around that nucleus pulposus, is still intact, okay? And that is intact. But that squeezing, that pressure, has created that nucleus pulposus to move. So the protrusion means the annulus fibrosus is intact. Now the next one is an extrusion. An extrusion means we actually have cracks in the annulus fibrosus. So once you have a crack in the annulus fibrosus, the nucleus pulposus, that jelly-like substance in the middle, starts to go into that crack. And that's an extrusion that starts to occur. And that extrusion means that it can keep on continuing, it can keep on going through, and it can hit the spinal cord in the back or the nerve root anywhere, okay? So it's basically following that crack and going and moving out. Just like a jelly donut, if you squeezed it hard enough, that jelly would start to now come out. And that's what's going on in extrusion. Now, the other one is what's called a sequestration. A sequestration is when actually a piece of that nucleus, a piece of that disc is now dislodged from the main disc area. So it's a free floating piece. And that free floating piece, this is a very severe condition because this could impact the spinal cord, this could impact the nerves, it could impact the nerve roots. So when you're looking at it and you have a patient come in and stuff, I know when it comes to a disc bulge, I can work with that. I can help that. I have great success with that. When they have a herniation, if it's a protrusion, again, I have a lot of great success with that. An extrusion, I have a lot of great success with that. A sequestration, I've had success, but that's more of a challenging case that I have to work with. So how does disc bulges actually occur? And if you think about it, well, disc bulges occur when we're sedentary a lot of times, when we are actually sitting for long periods of time. There's increased flexion that goes on because you get into that flex position, sitting, the gamers, the computer workers, the desk workers, the commuters that are commuting to work and stuff and spending like an hour in the car or anything longer or anything, even like 30 minutes there, 30 minutes back, that's still a period of sitting. And the desk worker who sits like 6 to 8 hours a day, or the gamer who's sitting there, they start to hunch forward. And that flexion, that torsion, that stress that starts to occur on that disc creates an increased load, which then over time, as that bulge starts to happen, it can start to weaken the annulus fibrosus. And the symptomatology you're going to see is that person's going to come in with back pain, stiffness, tightness in the back. It could be sharp pain too, but it's more a lot of times localized to that lower back area, many times, okay? And that's what I tend to see. Now we talk about the disc herniation. And a disc herniation a lot of times is an acute thing. So whereas a disc bulge can happen over a period of time, it's a compressive load that occurs over months or years, whereas a disc herniation can be quite acute. It could be a sudden onset. It could be something that you were doing, a lift, a strain, something like that, that just happen to rupture the annulus fibrosus. And a lot of times I find that a disc bulge could lead to a herniation because that annulus fibrosis has been getting weaker over time. And now you go to do something and bam, that causes your rupture. And when that rupture happens, now the nucleus pulposus starts to move forward into there. So then it leads to any of those three different scenarios I talked about before. And when you see a disc herniation, well, now it can lead to other problems because then it starts to impact the spinal cord, the nerve roots. Well, when that starts to happen, you can start to get pain down the leg. You can get shooting pain down the leg. You can get numbness, tingling down the leg or down the arms. You could also get weakness happening, dropping objects, a loss of strength happening, your legs giving out on you. Any of those things can start to occur when you start getting into the symptoms of a herniation. So the one thing that's concerning though is that when you don't address it, if you leave it unaddressed, it can get into some severe problems. And when is it a medical emergency? Really, a medical emergency comes in is when you're getting things like a loss of bowel bladder control. You find that you've got what's called saddle paresthesia. You've lost all sensation around the waist and the saddle area. These are concerns. If you've got those things going on, then that's a medical emergency. And you should be going straight to your medical doctor or to Emerge and getting that addressed. But this is where you don't want it to get to. You've got to start looking at this and saying, what can I do to help improve this? Step one I always talk about is when somebody comes in to see me for chiropractic care, it's always a game changer for a lot of patients and stuff. And we have a lot of success with it. But when it comes to anybody coming in, we'll first do an analysis. We will try to figure out exactly what we're dealing with, which helps us understand not only do we have to how we are going to approach this, but also how long it may take for this to heal. So when it comes to a disc bulge or a herniation, we're going to do our x-rays in clinic here. We have our own x-ray facility. We're going to do a computerized spinal scan. We're going to do neurological testing. We're going to do orthopedic testing. We're going to do whatever it needs to take to have a greater understanding. And if you've got reports, MRI reports, things like that, we want to view them. We want to take a look at them to have a greater picture of everything so that we understand what it's going to take not only to get it feeling better, but to start working some of that damage to get your body and tissues adapting and healing well. The other thing we talk about with patients is also exercise. I don't think it's negotiable. I think you have to do exercise and stuff. It's an important thing when you've got this type of a problem. And the exercise is only going to help you. We talk about core strengthening. We talk about things like McKenzie exercises that build on extension. We talk about pelvic tilts. We talk about bird dog, dead bug. These are all great things that you can do. And when our clients that come in here, we do prescribe exercises for them to do. We like yoga-based things too. That's also very good for you. We also have an acupuncturist in here, Maureen, who also, and we incorporate into the care too, that also helps to facilitate that healing. So it's an integrated approach for a complex problem that needs it to get better. An important thing to also understand is that disc herniations don't always require surgery. In some cases they may, but not always. And to me, I don't think that's always a first resort. You need to be able to see what you can do for yourself to help improve it, and then see if you're not getting improvement, then surgery may be the option. But there was a study that was done in Spine, in the Spine journal, that actually showed that without surgery being done, 90% of disc issues actually got better. And they did it through an MRI, a pre and post MRI. So the most important thing is you have to be active about this. You have to seek out the care that you need for this to look and see the improvements. It's not going to improve on its own. You've got to be proactive about it, and you start to look and see what improvements are you getting? How manageable is this getting for you? So let's understand all of this again. So when it comes to the disc bulge is where the outer casing is still intact. It's expanded, but everything is still intact. The herniation is when that outer casing is starting to get cracks in there, and that nucleus pulposus is starting to move accordingly. And you get 3 different types of herniations. And all of this can respond really well to conservative care, chiropractic care, exercises, things like that. And if not, then surgery is considered. But first, looking at the conservative approach on how you can help it. And a lot of cases do improve. Hopefully this has given you some clarity on what we do. And I encourage you to continue watching my videos, as I've got lots more videos on what I do and how I can help you. My name is Dr. Ali Shariff. I'm a local chiropractor in Oshawa, Ontario. I encourage you to like and subscribe to this channel because I will continue to post more content to show you how we can improve your health.